Learn smart, heal better, MBBS, study forever, read, revise, crack USMLE, future doctors, that's who we'll be, MBBS study.
Busulfan is an alkylating antineoplastic agent, specifically an alkyl sulfonate. Unlike many chemotherapies that only target cells actively dividing in a specific phase, Busulfan is cell cycle nonspecific. It attacks regardless of what phase the cell is currently in. It acts as molecular handcuffs. The alkyl group wedges directly between parallel DNA strands, creating a permanent DNA-DNA crosslink. When the cell attempts to unzip its DNA for replication, the machinery hits a brick wall. The tension snaps the strands, triggering the cell into apoptosis. Historically, this mechanism was used to manage chronic myeloid leukemia, but clinicians quickly recognized Busulfan's most defining trait. It is exceptionally precisely toxic to bone marrow stem cells. Its ability to force these structural DNA breaks makes it highly effective when the clinical goal is the targeted eradication of a patient's hematopoietic system. In standard oncology, wiping out a patient's bone marrow is a fatal adverse event that we work hard to avoid. With Busulfan, complete bone marrow suppression is the actual therapeutic objective. This makes it a cornerstone of the conditioning regimen given before a hematopoietic stem cell transplant. Clinicians often pair it with cyclophosphamide in what is known as the BU-SCI protocol. The biological intent here is total clearance. The drug ensures the patient's existing immune system and stem cells are actively cleared out, creating the physical and immunological blank slate required to accept the incoming donor transplant. In this transplant setting, Busulfan serves as a demolition crew, clearing the marrow so the donor cells have the space they need to grow. Executing this cellular clearance requires a rigorous mathematical approach. The standard adult IV dosing protocol is highly regimented, 0.8 milligrams per kilogram of body weight, administered every 6 hours for exactly 16 doses. That rigid 6-hour spacing is non-negotiable. The goal is to maintain a highly specific concentration of the drug in the bloodstream to guarantee marrow clearance without crossing into systemic toxicity. We look at this pharmacokinetic graph to understand how tight that margin for error is. Clinicians constantly adjust the dosing via therapeutic drug monitoring, ensuring the area under the curve stays perfectly within this highlighted horizontal band, completely avoiding the danger zones above and below. Relentless, precise pharmacokinetic monitoring is the definitive mechanism that keeps a controlled marrow wipeout from cascading into a fatal overdose. Let's translate that rigid formula into a real-world clinical timeline. Imagine you have a 75-kilogram adult patient scheduled for conditioning. Pause the video. Calculate the required single IV dose, and then determine how many days this conditioning phase will take based on the 16-dose rule. First, multiply the 75-kilogram weight by 0.8 milligrams to get a single dose of 60 milligrams. A dose every 6 hours means 4 doses per day. Dividing 16 total doses by 4 daily doses gives exactly 4 days of treatment. Breaking down the protocol reveals a highly structured, continuous 4-day infusion phase leading right up to the transplant. A chemical agent powerful enough to systematically eradicate the body's bone marrow causes collateral damage to surrounding organ systems. Clinicians must manage 3 major toxicities targeting specific organs. In the lungs, patients risk severe pulmonary fibrosis, or Busulfan lung. In the liver, the drug frequently causes veno-occlusive disease. Finally, high serum concentrations reliably induce acute seizure activity in the brain. Because these seizures are so predictable, prophylactic anti-epileptics, such as levetiracetam, are mandatory. They must be administered prior to the Busulfan infusion. Additionally, clinicians must avoid any concurrent drugs that lower the patient's seizure threshold. Safely managing Busulfan requires anticipating and chemically blocking this collateral damage before the very first drop enters the patient's bloodstream. Let's review the clinical profile. Busulfan is an alkylating agent that creates fatal DNA crosslinks. Its primary modern use is in pre-transplant conditioning regimens to eradicate bone marrow stem cells. Dosing relies on a strict 16-dose weight-based protocol managed through continuous AUC-guided drug monitoring. Success depends on mitigating pulmonary fibrosis, veno-occlusive disease, and preventing seizures. The transition from DNA-level destruction to a successful bone marrow transplant requires this exact balance of dosing precision and toxicity management.
Thanks for watching MBBS Study. Keep learning daily. Like, comment, subscribe today. See you doctors on the way. MBS Study.